Clinical simulation is a learning methodology has helped to improve clinical practice and reduce the error in terms of diagnosis and treatments. In clinical simulation, students transfer their conceptual and procedural knowledge and attitudes to a controlled environment, which favors the educational objective of the clinical area. For this reason, it's important to validate the construct of a self-efficacy scale that allows measuring whether students are acquiring the necessary competence in clinical simulation. In self-efficacy, people believe in their capabilities to produce desired effects by their own actions are the most important determinants of the behaviors people choose to engage and in how much they persevere in their efforts in the face of obstacles and challenges. Construct validity refers to how well you translate or transform a concept, idea, or behavior that is a construct into a functioning and operating reality, the operationalization. Validation study is the degree to which items and instruments reflect the content universe to which the instrument will be generalized. And patient simulation. The human patient simulation represents the latest in the state-of-art simulation technology for educational healthcare providers at all levels and disciplines. This life science mannequin with a sophisticated computer interface allows providers the experience by patient scenarios involving numerous pathologies and response to a variety of interventions.
Okay, the problem statement is that there are few validated instruments that measure self-efficacy in physical therapy students. So, this study aims to answer the question, does the self-efficacy scale effectively measure the self-efficacy of physical therapy students attending cardiopulmonary clinical simulation in the first period of 2021? On the other hand, in the justification, the validity of a self-efficacy scale is carried out in order to contribute to the search by testing, evaluating of pedagogy and improvement educational process. By the way, the general objective is to validate the content and structure of a self-efficacy scale in physiotherapy students in clinical simulation in the cardiopulmonary area in the first period of 2021. And the specific objectives are first, to review the literature to select a clinical simulation self-efficacy scale. Second, to determine the face validity of a self-efficacy scale. Third, to determine the content validity of a self-efficacy scale. And last, to select the experts who will judge the scale being evaluated.
I'm going to talk about the theoretical framework. Clinical simulation is a pedagogical tool that consists of the simulation of clinical scenarios in order to develop skills, integrate knowledge, and simulate learning based on experience, which have a favorable impact on the student performance. It is also necessary to talk about self-efficacy, which is understood as the belief that people have in their ability to produce the desired effects through their own actions, which in our world is the confidence and fluency that the students have in a clinical scenarios when they are making decisions. Currently, there has been a growth in the use of simulation based in technology through mannequins, virtual simulators on clinical environment, especially in the pulmonary cardiovascular area, which provide tools for the development of skills in cardiopulmonary revival, intubation, and intervention on critically patients. On the other hand, in the international arena, human simulation has been reported in 37% in the curriculum of the United States and Canada programs, while in Latin America, only 70% of all programs include it, and 9% in physiotherapy programs have it too.
Okay, continuing with the part of the self-efficacy at international levels, self-efficacy scales have applied in scenarios that have clinical simulations in different countries such as Madrid, Spain, and Chile, where these scales were applied given a positive results by having the clinical simulation implement, but as well as at national levels there is little evidence of a scale of the self-efficacy in clinical simulations for physical therapy. Finally, a self-efficacy scale will be validated to apply in clinical simulation in physical therapy students.
I'm going to talk about the methodological framework. Our study type is described cross-selectional study, and design type is quantitative design. Because since the analysis will be based on data obtained from the application of the quantitative instrument. The population criteria is physiotherapy students from the Universidad de La Sabana who are joined to doing simulated practice in the cardiovascular pulmonary area, and sample criteria without distinction of gender and or age, who have taken and passed the course evaluation and physiotherapy diagnosis 2 and intervention process 2. Our variables dependent is learning and skill in the development of physiotherapy process in the pulmonary cardiovascular area, and experience in the management of patients with pulmonary cardiovascular compromise. And variables independent is semesters of students and rotational sites with an emphasis on the cardiovascular pulmonary area.